Hey, my name is Aaron Tyner, and today I'm going to be demonstrating the tracheostomy suctioning and trach care skill for you. So before I go into the room, I'm going to make sure that I have all the supplies that I need and they're clean, dry, and intact, and that they are within expression. So once I go into the room, I'm going to knock on the door and I'm going to perform hand hygiene. I'm then going to introduce myself to the patient. Hey, Mr. Teddy Bear, my name is Aaron Tyner. I'm going to be doing trach care on you today. And then I'm going to also make sure that I look for the wristband. Once I have established or started talking to them, I'm going to then establish a method of communication with the client. It could be something as simple as them writing on a whiteboard, or it could be something like them pointing to in the room to what they need. At this time, I'm also going to be looking at the tracheostomy itself, and I'm going to assess the need for suctioning. I have assessed the tracheostomy, and they do need suctioning at this time, so then I'm going to explain to the patient what I'm going to be doing, and then I'm going to apply a pulse oximeter to the patient. The pulse oximeter is just there for me so I can have an idea of the oxygen levels in the patient throughout the skill. I'm then going to provide privacy, and then I'm going to then prepare my work area. My work area is already complete. I'm going to make sure that there is a trash can at the bedside. I'm then going to wash my hands and put on appropriate PPE. I'm just going to put on gloves right now. The patient is already positioned in a semi-salus position. If they were unconscious, I could put them in a sideline position, making sure that they face the nurse. I'm then going to place a towel over the patient's chest, just to protect them in case any kind of fluids come out. I'm then going to check the suction equipment on the wall, making sure that it's working. I'm going to occlude the ends of the pipe or the tubing with my finger to make sure there is pressure. I also forgot to, I'm going to loosen one side of the trach collar. Alright, so once that's done, I'm gonna make sure, like I said, then this is when I would check the flow of the oxygen, making sure that the suction is at the proper level. I'm also going to make sure the suction tubing on the wall was within reach for me, so when I do go to suction that it's okay. At this time, I'm going to remove my gloves. And I'm going to save these because they do not have another set. And I'm going to wash my hands. And at this time, I'm going to open my suction kit. I'm going to use a aseptic technique when opening it. So when I open it, I'm going to grab the little cup, making sure that I only grab the outside edges, and I'm going to open that up, setting it away from the area. I'm then going to get my sterile water and I'm going to lip it. Once I've lipped it, I'm then going to pour some into the cup. At this time, I'm going to apply appropriate PPE. That's going to be a mask with a shield and a gown. Both of these would be unused. Making sure that I've covered the back perfectly. This time I'm going to wash my hands and I'm going to don my sterile gloves. this happened, I would get a new set of sterile gloves but for demonstration purpose, I'm just gonna keep moving forward. But I would get a new glove if this happened in the real life. So once they're on, I'm gonna fix them. I'm then gonna pick up the tubing with my dominant hands. I'm right-handed, so I'm gonna pick it up with my right hand. And then going to connect the tubing here. And then this hand is no longer sterile. And then I'm going to dip it into here, then moisten it, and then I'm going to remove the oxygen with the tubing hand. I'm then going to begin suctioning. When I'm suctioning, I'm not going to suction for longer than 30 seconds, but making sure that I don't go the suction below 15 seconds. I also forgot to add that with my non-sterile hands, I'm going to remove the trach collar. Once I've done this, I'm going to make sure that I do this a minimum of 3 times, making sure that I clean after each suction, and making sure the catheter is clean. I'm then going to wrap this around my hands once the suctioning is done, and take the gloves off and throw this into the trash can. I'm going to make sure the suction is turned off. And I'm going to make sure that I assess for the effectiveness of the actual suction itself, asking the patient to take a couple deep coughs, making sure that they're able to breathe properly. I'm then going to properly dispose of any kind of soiled equipment, and then I'm going to put the oxygen back on, and then I'm going to clean this up, and I'm going to prepare for the actual tracheostomy cleaning. My mask is fogged up, so if this happened in real life, I would get a new mask, and put it back on, and get a new one after I got a new mask. So once I do this, I'm going to clean my hands, and then I'm going to get the tracheostomy kit itself, and I'm going to set up my sterile field after I open it. Making sure the spiny side is down. If that happened in real life, I would get a new one. The tracheostomy is set up, and then I'm gonna wash my hands and put on clean gloves. Once I put on the new clean gloves, I'm going to remove the oxygen once again, and I'm going to remove the inner cannula, and I'm going to place it in the proper receptacle. Once I do that, I'm going to take off the gloves and perform hand hygiene once again. I'm then going to put on sterile gloves. Before I put on the sterile gloves, I'm going to put the sterile water into the tray. I'm going to lip the fluids, and I'll put a small amount into the tray. I'm then going to wash my hands again, and put the sterile gloves on. If that happened in real life, I would get another pair of gloves because I just broke sterile field. But I don't have any more sterile gloves, so actually I do have another pair of sterile gloves. So I'm going to trash this set, and I'm going to wash my hands, and I'm going to get another pair of sterile gloves. And then fix the gloves. Once this is done, I'm then going to get the cotton tip applicator out. And I'm going to remove the older split galls. And then I'm going to clean around the stoma with the cotton tip applicator, making sure that I'm gentle and so I don't do any kind of cause any kind of trauma. I'm then going to throw that into the trash can. Once I place that into the trash can, I'm then going to dry with a new applicator with the sterile galls. Once I've cleaned the sterile galls, this goes into the trash can. And then I'm going to apply the new tracheostomy dressing. I'm then going to get the new inner cannula, sterile inner cannula, and I'm going to insert this. So it gets in like that, making sure that I avoid any kind of trauma. I'm then going to reattach the tracheostomy collar itself. Making sure that it's not too tight. I'm going to make sure that I can get 2 fingers underneath it, like so, and then I'm going to reattach the oxygen. Once the oxygen is reattached, I'm going to clean my area up. Once the area has been cleaned, and everything is in the proper location, I'm going to make sure that my patient is in a comfortable position. Once I make sure that my patient is in a comfortable position, I'm going to take off my gloves, remove them appropriately. I'm going to take off my mask, put it in the proper receptacle. I'm going to take off my gown. Take off the gown. I'm then going to put this in the proper location. I'm then going to wash my hands, and I'm going to make sure that I document all the care that was provided to the patient today. And this is the end of the skill. Thank you.